In this sketch, we're going to cover Trypanosoma cruzi, the parasite responsible for Chagas disease. Our story will take place on a cruise to symbolize the star of our show, T. cruzi. And this cruise is on a voyage from the US of A to Latin America, so it's the Pan Americas cruise line, because this is where T. cruzi is mainly present. Come join us on the Lido deck for some fun and fitness. Trypanosoma cruzi is an important microbe to cover because it is the cause of Chagas disease, a vector-borne disease that affects the heart, GI tract, and nervous system too. We really want you to remember the connection between T. cruzi and Chagas, so we're depicting this with a little bit of sketchy humor, but know that this is a devastating disease that disproportionately impacts marginalized persons, and we do not make light of that. Meet our movement coach, who happens to be a little gassy. Wow, he is like totally relaxed. Yeah, so I'm gonna namaste away from that guy. Okay, let's get to know a bit more about this parasite. Trypanosoma cruzi is a protozoan parasite. And we've symbolized our parasite with this peacock feather because trypanosomal species are long and thin with a sort of feathery membrane in a single long stem-like flagellum. And this parasite has a really complex life cycle, which involves stages in the vector and in the human host. We're not going to get into all the details of the parasite's development in the vector, but you should know a bit about the vector itself. These 3 atoms on the logo here should remind you that the triadenine bug is the vector for T. cruzi infection. The triadenine bug is a type of reduviate bug, so you may see that term too. Commonly, these are called kissing bugs, and you'll see why in a moment. The thing you should know about T. cruzi is it comes in a few different morphological forms, and these are important to its function inside the host. Introducing the amastogote and the trypomastogote. We're going to represent these forms pretty cleverly with, well, some goats. Goats, yoga, and rampant flatulence. The amastogote is the replicative form of T. cruzi, represented by a masterful pose in goat yoga, the downward dog. Remember, this is an obligate intracellular parasite we're talking about, so it must be inside the host cell to replicate. And to remind you that the amastogote replicates inside the host cell, we've added this sign here. Although I feel like this sign is unnecessary. Who on earth would want to leave this cruise anyway? The trypomastogote, represented by this triple master goat yoga triangle pose, is an infective form of T. cruzi. The trypomastogote can infect a variety of tissues, but does not replicate. The trypomastogote is found circulating in the blood and can be seen under the microscope. Pay close attention to these 2 goat yoga masters, because, believe us, things will keep getting interesting. Okay, let's move on to epidemiology. T. cruzi is endemic to Latin America, spanning the southern United States to Argentina and Chile. This area below deck is here to remind you that this parasitic infection is found in areas where housing conditions are less than optimal. The triadenine bug can hide in breaks and cracks in the walls or ceiling during the day and come out during the night to take a blood meal. Besides vector transmission, transmission via blood transfusion or vertical transmission, i.e. in utero transmission, are possible. And we're using a child here to remind you that many infections with T. cruzi occur during childhood, including a congenital disease, which we'll talk about in a moment. So how does this parasite cause infection? Well, it all starts with the bite of the triadenine bug, which usually bites the host on the face, right near the eye, the so-called kiss. After biting and drawing blood, the triadenine bug defecates, releasing the parasite into feces. Gross! Talk about pooping where you eat. Anyway, which form do you think we're talking about here? That's right, the trypomastogote. And to remind you of this, we've got our triple goat yoga master being covered in goat. She really is a master. Wow, she's holding that pose. The parasite then enters the host body through mucous membranes, or directly through the open bite wound, swimming through the bloodstream until it finds just the right host cell in which to replicate, most often in the muscle, including cardiac muscle, or nervous tissue. It's the amastogote form that undergoes intracellular replication, so to help you remember this, we have our A-shaped master here who is really bulked up. And there's 2 important anatomical sites to remember with T. cruzi, the heart, and the gut, hence the crop top. So it should come as no surprise that T. cruzi has a propensity to go for the myocardial tissue or myenteric plexus of the GI tract. Okay, let's really dive into the details of Chagas disease. Acutely, infected hosts may have fever, hence the flame bandana on our triple master. Yep, fever is due to those circulating tripomastigotes. That's pretty nonspecific, but a big clue that a person has been infected is a classic lesion known as the shigoma, which, unfortunately, only occurs in less than half of cases. And if you'll notice, our A-posing master now has a swollen eye because the shigoma is an inflamed and swollen area that's actually housing lots of monocytes and intracellular A mastigotes. Typically, the acute phase is diagnosed by visualizing the motile bloodstream tripomastigote seen on blood smear. Before we move on to the next phase of Chagas, we should mention that congenital Chagas disease is also considered part of the acute phase. Congenital Chagas, represented by our gassy baby coach, is marked by low birth weight, anemia, and hepatosplenomegaly. The next phase of Chagas disease is the chronic indeterminate phase, as depicted by this grandfather clock, Sketchy's recurring symbol for chronic conditions. This phase is marked by a 10 to 30 year asymptomatic period. Even though the patient may be unaware that they have Chagas, the serology is positive for T. cruzi. This is followed by the chronic determinate phase of Chagas, where heart and/or GI disease appear. Cardiac manifestations of Chagas include hypertrophy and dilation of the heart, hence the floating heart. So make sure to put Chagas disease on your differential for heart failure, arrhythmia, and thromboembolism, classically a mural thrombus in the left ventricle. Chronic infection with T. cruzi can also fibrose the myenteric plexus of the GI tract, leading to megaesophagus and megacolon, as well as gastrointestinal dysmotility. To note, gastrointestinal Chagas is more rare than cardiac. Okay, let's wrap this sketch up with prevention and treatment. Prevention starts with controlling the vector population, such as through the use of insecticides. And because substandard housing conditions increase exposure to the vector, structural modifications to homes is a key preventative measure. Don't mind our dust, or crop dust. And Sketchy's patented PPX shield on the TV screen should remind you that we can also prevent vertical transmission of T. cruzi infection through developing programs to screen those who can become pregnant. Identified cases should be treated with benznidazole before they become pregnant. Hence the forward bend pose here. Also, pregnant people with an acute infection who plan to breastfeed should be advised against doing so to prevent transmitting the infection to their baby. For treatment, there are 2 approved drugs for acute infection, reactivated infection, or for children with chronic infection: benznidazole and nifurtimox, cleverly represented by the furry moccasins. However, benznidazole is better tolerated and is considered first line in most cases, so we'd lean towards that if you want to choose the correct answer choice. And that's it for T. cruzi. We hope you've enjoyed this cruise and didn't mind our crop. Oh, that reminds me, I gotta go book my ticket. See you next time, and until then, stay goaty. Sketchy. Well, both, actually, preferably.